5, 4, 3, 2.
Hi, good evening. I'd like to call to order the Delaware County Board of Health meeting for March 2nd, 2023. At this time, I have two chair announcements. We had an executive session held on February 16th. And then also wanted to announce that the Maternal Child Health Coalition had its first meeting on February 7th. This was the inaugural meeting of the newly formed Delaware County Maternal Child Health Coalition, convened by the Delaware County Health Department. Dr. Monica Taylor and I will be co-chairing this committee. We are excited to work with our community partners to begin planning on a real action steps to advance maternal child health in Delaware County. And at this time, I would like to offer the opportunity for public comment on any agenda items. Seeing none, we'll move to approval of the minutes. At this time,
Motion to approve.
motion by Oni to approve.
Second.
And seconded. Great, all in favor?
Aye.
Okay.
Aye.
Our minutes have been approved. At this time, we'll have the board updates, including the Delaware County Health Department operational update and by Health Department Director Melissa Lyon.
Good evening, everyone, and thank you, Chairwoman Halt, for this meeting this evening. So today's operational update, I thought it would be important to discuss some of the activities we've been doing around our outbreak investigation, and two in particular are listed here today. One was around tuberculosis, and the other was around hepatitis A. And so it really gave the team an opportunity to cross-divisionally work to respond to positive tuberculosis and prevention. How we identify individuals that are positive is through laboratory confirmation and or visiting at our clinics and doing diagnosis. And once it was identified that the individual, as I'm sure many of you have seen, this one did go in publicly into newspapers and media reports, had been in a school, and the team quickly responded by reaching out to the school leadership very promptly, talked through with them what was potentially the level of exposure to individuals in the school, and then a response plan, meaning offering up testing for anyone that would be in the level we would consider at potential exposure, and or anyone that would self-identify as potentially being exposed. I have to highlight the work around that. Anyone that could self-identify. The team was exceptional in their ability to mobilize quickly and want to serve anyone that wanted to receive testing. In this case, testing is a blood draw, and we worked closely with the school district to do that in their school and get consent forms home to their families very quickly. So by Monday, the information received us, and we were testing by Thursday, which is pretty phenomenal, and offered that 2 days and also Saturday options for those that weren't able to come to the school. I think, overall things went very smoothly. And this is really meant to be complimentary when I say this team got together, really problem solved, and being that we're not even 1 year old, I've seen established public health departments that wouldn't have executed as quickly or as fastly as they have. And it was, and I mean this with a really a fond heart, that they almost didn't know what they didn't know. And so the impossible absolutely was possible for this team. So I really have to commend them tremendously. At this, through that, there was one individual that did end up testing positive. That was not through our clinic. That had been done through their own provider. So they're receiving treatment, and now we will do a second round of testing because you want to do that follow-up. So that will be happening and coordinated as well. Within the hepatitis A, really happening almost simultaneously was a person that had been identified as being Hep A positive and was an employee in a facility, in a workplace. And so the environmental team being overseeing the regulatory aspects of the facilities for the Delaware County Health Department, worked collaboratively with the nursing team and the disease investigation team, went in, identified anyone that may have been an exposure for hepatitis A, and then quickly mobilized to offer vaccinations for those. The window was beginning to close on how quickly a vaccine or post-exposure prophylaxis would be effective. But again, that happened very quickly, and we did have a few that did follow up with post-exposure either at our clinic or their provider. So, I mean, I have to say, like, the team exceptionally, we got together and cut through some really important work and mitigated the public health hazards around that. So I also want to acknowledge that we wrote an abstract and submitted it to the National Association for City and County Health Officials conference that will happen in July. And those abstracts have been reviewed, and we should know in the near future whether we were selected to present or not.
Any questions? The report?
No, well done. Yeah, the team did it. The team was really exceptional. Would you like me to go to my second? I don't know if it's on yours, Capitol Hill Day?
Well, yeah, and I just want to follow up too.
Sure,
because I
please.
know there was a lot. These two incidents were fairly close together,
Yeah.
and it was a lot. And I just want to again thank the health department team for their response. And this is what they kind of trained for and they're ready for. And it all came to happen very effectively. And it's really a credit to particularly Stephanie Reese and the environmental health team.
Epidemiology and disease.
Everybody.
It literally was what it was. It's
Yeah.
what we're trained for, to get all three divisions to come together. I mean, it was magic, as I like to call it.
Yeah. So, you know, and it's really shows what the health department can do and even get better. So, great job.
I'll move on to the second update. And Rose, I added this one on after thinking about where I was going to be this week.
Mhm.
So I'm a co-chair for the State Association for City and County Health Officials. So we call it the SACHO, and that's for Pennsylvania. I co-chair it with Philadelphia, and every year they have 2 in-person meetings. Normally one's in Washington and one is at the annual NACHO conference. And then we do monthly meetings virtually. And the one that's always in Washington, DC, we coordinate that with Capitol Hill Day, which means we go and speak with our US representatives and US senators about the importance of public health. A lot of it is just about the education of the work that we do, as well as sort of highlight any potential opportunities to support public health, whether that is with legislation that's coming through or not. NACHO goes as the lobbying entity in those meetings. We go as the supportive and educational entity, really discussing public health on the ground. And so this year, this is, I think, my 5th year. This year we went, Chester County joined. So Jean Franklin joined as well, which was great. And then Commissioner, Philadelphia Public Health Commissioner joined. And we went to Senator Casey, Senator Fetterman's office, and then I visited Representative Scanlon's office. And this year's agenda was to talk about Public Health Workforce Repayment Program. It's passed legislation and it now needs to have funding. So there's a letter that is circulating in the Senate, in the House for that to support that appropriations. So that would be a really beneficial piece of legislation with the funding that will impact retention and recruitment of public health staff for the near future. The other component to the conversations we had around education is what we call disease agnostic funding. And so monies that don't come specifically to address just disease specific, but more broad reaching so that we can implement that. So the workforce infrastructure and data modernization monies that came through the CDC, through the state, that will be reaching Delaware County, all of the local health departments is an example of that. And we were advocating and educating around more of that sustainable type of funding that also reaches the local levels. So I have to say it was a very successful visit. It's nice to be with the colleagues and hear what's happening across the state and the country. And I really do want to mention that in being in Fetterman's office, his team is really hard at work. And it was heartwarming to see the amount of letters and cards and written mail that he's receiving in support of his recovery. And I think it's just so important for the destigmatization of mental health. It was powerful. So I want to share that piece as well. So that's my update.
Great, thank you. Thank you. Any questions?
Don't have any.
Okay. And we'll be moving to some new business. And right now we'll have a presentation by the epidemiologist, Dr. Victor Rulon.
Good evening. My name is Victor Aulos Rulon. I am very happy to be here to share some information about the Department of Epidemiology at Delaware County Health Department. Oh, I forgot, we have this thing here. Okay. Well, is it working?
Oh, he just needs a second. He has to
Okay.
load it up for you.
Well, let me say this. The Department of Epidemiology pretty much follows the mission and vision of the health department in several ways. We like to identify what is preventing Delaware County residents from enjoying a healthy life. That goes along with the vision of the health department. Okay, it's working. And when you look at the mission, we promote a collective effort to ensure that our residents have the best health and quality of life. So that's what the main goal, like they call it here, the North Star of the Epi department. I thought that it would be good to include what are the goals of the Department of Epidemiology. And what we do, we follow the CDC guidelines from the Epidemiology Intelligence Services, and also the Council of State and Territorial Epidemiologists, as well as the Department of Health, the Pennsylvania Department of Health Epidemiology Division. So we follow their guidelines, their goals, we coordinate. So when we collect the data, we put together a collective effort. And the team right now enjoys a good number of individuals. Disease investigation specialists, including a nurse who is specializing in healthcare acquired infections. And all of this is possible because of the support and guidance from our leadership, Director Lyons and Deputy Director Laura Werner. So all of this is happening because of their support and guidance. In addition to these goals, I'm happy to report that we have access to more data, more precise data, and that will help us to answer some complicated and complex questions. We basically investigate what, who, where, and when. What is actually of how these diseases are affecting our populations. In general terms, and following CDC and the Pennsylvania Department of Health guidelines, we would like to recognize public health problems. Then we conduct surveillance activities, monitoring activities, and I will be giving some examples of these measures and things that we have been doing in the last, since April of 2022. We identified acute and chronic conditions, we organize data, and then we present summarizing data for action. Now, when we look at common measures that we use in epidemiology, this is not all the list, but we're looking at the main ones: morbidity and mortality, which will describe the progression and severity of a disease, how diseases affect the population. We also, when we talk about mortality, we look at risk. When we use rates, we can compare what's happening with one population with another when we use rates. We also use incidence, which is the number of new cases. So we look at a population that never had the disease and developed the disease. That's the incidence, new cases. When we look at incidence rates, then we're looking at risk. What is the risk of population in X municipality developing diabetes or developing another type of disease? I have here also that when we standardize these rates, we're able to produce comparisons that are valid, in addition to just counting the numbers. These are some of the measures. Last week, we had the experience of investigating complaint about a cluster of cancers in a municipality in Delaware County. So we had to use another measure, which is called the standardized incidence risk. And that tells us if the observed and expected number of cases is similar or not across time. And I will be talking a little bit more about that in the next slide. Data sources, we have primary data sources collected from, for example, when there are clients going to Delaware County vaccination clinics, we have the intake forms. We collect information about their demographic information, health history, allergies. That way is a primary data collection. Secondary data collection is when we use data collected by other sources. For example, the Department of Health in Pennsylvania, when there is a lab test for any type of disease is uploaded into electronic system, we collect that information to do analysis, investigation, and case management. And I will give you a nice example in the next slide. Worthy of mention is this one called PADOH SAS, ASSEG. This is a wonderful data set that we can download to conduct more precise investigations to compare diseases. For example, what is the prevalence or the rate of hepatitis A cases in 1 week? We can compare what happened last year, the same week, and we can compare the week before in many, many years, sometimes going back to 20 years. So those are examples of primary, secondary data. We also use metadata from Google Analytics, which is collected from websites, informatics. Now, when we look at some of the basic tasks of epidemiology division, we have to talk about outbreak investigations. And again, we follow the guidelines established by CDC and the Department of Health in Pennsylvania. The basic steps includes verifying whether or not there is an outbreak, coordinating with local, statewide, or nationwide. And by the way, there are many types of outbreaks. You can have local outbreaks, you can have state outbreaks, you can have multi-state outbreaks, and you can have national outbreaks. Depending on the type of outbreak, then we use a specific tools to collect information about who is ill, who is not ill, who ate this type of food, who was exposed to this substance or not. And that way, we can actually be able to see what actually is happening. Let's see right here. I think I moved one way too fast. There we go. I thought I was going too fast. So this is about the outbreak again. Once we verify the outbreak, then we have to define the case. Is it by symptoms, by clinical labs reports? And then we have to find the cases, like I mentioned, list the cases with and without symptoms, with dates, the onset of symptoms, the type of symptoms, and so forth. With that, we can develop a hypothesis, what might be possibly creating this condition. We also have to find out the mode of transmission and exposure. All of these things, what might be the source, the mode of transmission and exposure will help to stop spreading the disease. So that is the purpose of all of that. Testing the hypothesis, we have to verify either two ways. Clinical lab identify, for example, a lab report, a PCR test for COVID, a PCR test for E. coli, and so forth. Another way is to use the analytical method to compare a group. And for this case, we use what is called, and you're going to see at the last part of the slide, a list. And in that list, we look at exposures of beef, ravioli, type of food, whether or not the person is ill, and the total numbers. And then we look at the number of persons that did not eat the food, whether or not they are sick. And with this, it helps us to calculate what's possibly be the reason for the outbreak. Now, I'm going to describe something that I love doing every day. This is an example of surveillance, and I am using the example lead poisoning. This is something that is done on a daily basis, including weekends. We're looking for lab reports with elevated blood levels reported by hospitals and physicians in children less than 16 years of age. Individuals over 16, we coordinate with the Pennsylvania Department of Health for case investigation and case management. Case investigation and case management are two different things, and I will describe them in a short while. Now, when we have these reports, we proceed with the case investigation. If we find a lab report with an abnormally high number, elevated number, for example, over 15 micrograms per deciliter, we immediately have a system that the nurse who is doing the case management includes calling the family to investigate and to provide information how the family can reduce the possibility of additional lead entering the body of the child. And that can be done by housekeeping techniques, washing toys, the floors, also by providing dietary, also by instructing the parents if they to leave their shoes outside. And there are many, many ways case management services are provided. At the same time that this nurse is alerted, there's another person in the system that is involved with inspecting the home for lead and also providing information about mitigation, how to reduce lead in their homes. So all of this is happening at the same time with the system that we have. The slide will show you how we have a total of 776 investigations from January 6th to February 10th. The number of unduplicated number of children, confirmed children. This is an example of surveillance. Like this, we also surveil other diseases. The next slide will talk about example of what, where, and who with a norovirus outbreak in a long-term care facility. Now, the beauty of this is that we're going to look at who. So by doing that, we look at gender of who is being impacted. We're also going to look at the age groups. If we look at the slide, you see that most of the cases are happening in a specific age group, 77 to 86 years of age. If you look down, you see that average age for the female case, 84, and the male age is 76. So this is who is being affected by age, by sex. Also, we look at the location. Where are these cases mostly happening? As you can tell from the slide, most of the cases, 19 cases, took place in Building 1. So how is this helping the people at the long-term care facility? Well, because if you have this information, you can pretty much try to intercede and see what is going on with this age group and also in the building. Maybe recommend additional measures for mitigation and prevention. Now, if you look at the slide on the top, there's a bar chart. It's showing the number of outbreaks, 2 or more cases in a given year for the same long-term care facility. And what this is showing that the number is decreasing. This is helping us to appreciate whether or not the number of outbreaks happening this year is different from previous years in this same facility. The lower chart, all blue bars, it's a beautiful example of what is called the epi curve. And you're going to see peaks and valleys, telling you that this is a person-to-person propagated type of disease. Again, beautiful, very elegant measures in epidemiology to know what's going on. Norovirus is very difficult to prevent, but there are many ways that we can do that. How it's contracted, it can be from handshaking, providing care, and also touching surfaces. Very interesting to know that hand sanitizer does not work very well against norovirus. You need to wash your hands for at least 20 seconds, and the surfaces need special cleaning. Now let's look at another epi measure right here. This is very interesting. This is about prevalence. So what is the prevalence of what reportable diseases? If you look at the table on your left, on the extreme left of the slide, you're going to see something like 22 years, Delaware County, 2000 to 2023, and you're going to see a list of reportable diseases beginning with chlamydia, 50,000 cases in 22 years, Delaware County. What is the second one, most frequent one? Flu A with 28,000, hepatitis C, the third most frequent one, gonorrhea, the fourth. Now, what is interesting to note here, when you look at the table in the middle, look what's happening. You're going to see the same diseases in frequency again. This is the 2022 fourth quarter, and you're going to see more or less the same diseases with the highest frequency. Chlamydia again, and hepatitis B chronic. So it is fascinating that we have access to these data sets that we can go back in time to compare whether or not these things are changing over time. Another measure of epidemiology is incidence, new cases. For that, we use the example of tuberculosis that Director Lyon spoke about earlier this evening. If we look at tuberculosis, in this example, on the day of January 23rd, we received 2 confirmed cases. So what we did, we look at the number of cases, the range of cases. A range might be from 0 to whatever high number. We look at the range of TB cases for all ages at the same week under year, but we look at in 2021, and we look at the same week, 2022. And what we found is by 2021, the range of TB cases was 0 to 5. 2022, the range of TB cases in that same week, 0 to 1. Now, if we only had 2 confirmed cases in that week, then we would be above the 22 weekly range, but we would be within the 2021. Again, helping us to measure whether or not these diseases are actually increasing or decreasing over time. It's also important to note that this tuberculosis outbreak required the coordination of everyone in the department, the nurses and DIS workers, disease intervention specialists, the public health physicians, Dr. O'Mahony. So I think we are really a great team, and I am very, very proud to be participating in this effort. The last slide that I have here, it's another epi measure, mortality. Mortality and this one is cardiovascular diseases like stroke, and thrombosis and things of that nature. This one is age adjusted, so we are adjusting for age so we can compare the same different populations. Age is a risk factor, so we cannot compare people that might be older because with age comes increasing number of diseases. So we adjust for age to make these comparisons compatible and valid. What we're looking here is the Delaware County cardiovascular diseases death rate between Black and white individuals. And if you can see, the orange bars are the ones representing Black individuals, the blue bars, white individuals. And now you're going to see two lines, one going up, one going down. The slide and the data is telling us that there's a decreasing trend of cardiovascular diseases death rates among white populations, and there's an increasing trend among Black population between the years 2016 to 2020. So we look at the data, we look at years, we look at trends, and so forth to get a better understanding of what is going on with these diseases and what can we possibly think of doing to reduce the severity and hopefully prevent the diseases. Last one is the references, and of course, I will be happy to answer any question. Thank you very much.
Thank you, Victor. Thank you. Does anyone have any questions for Victor? I have a quick question, and it's just a general one, Victor.
Yes.
So looking at the data, it's just really fascinating to me to see the sexually transmitted diseases being so high. And maybe you could speak to the trends you're seeing in that.
When we look at the data, for example, from the SAS files, we look at the frequency of these sexually transmitted diseases, and in fact, it is happening nationwide. There's an increasing trend in syphilis and gonorrhea, and some people say that this is because of what the COVID pandemic put a break on people accessing care and the healthcare system. But it is a sad truth. It is happening, including congenital syphilis. Now, chlamydia is the most frequently reported sexually transmitted disease in the nation. So there is no surprise there. And many individuals do have this condition. So it is primarily the first one. However, it is sadly true. Sexually transmitted diseases, gonorrhea, and syphilis are increasing.
Thank you.
I have a question. So if the statistics, it looks like, when we look at cardiovascular disease and the rates, even with STDs as well, but I think the health department is more focused on population health. But most of these are happening on an individual level, right? So do we have a plan to address this, especially for the uninsured or underinsured populations who don't have other routes to care to look at some of these issues that are impacting the county?
Thank you for the question. This is, again, I love this type of work, as you can tell. I've been in public health since 1978.
Mm-hmm.
What is getting really very interesting is that we have access
Mm-hmm.
to very special data. It's called protected data. With that access that we just got the approval this week, we can look into more specific characteristics of the population. With that, we can propose
Mm-hmm.
a plans, strategies, so our leaders can combine the efforts of the departments and decide what is the best way to approach the prevention of the disease. And we're going to look at modifiable risk factors, things that we can change. I cannot change my gender, my sex, or my age. I wish I could, but I can change my behaviors, my knowledge, my skills. So that's where we are going, but we are going to be traveling that path with precise data and a coordinated effort. So everyone double checks, triple check the data and the message that goes out. So that's our plan, yes.
Thank you.
And if, I mean, if you don't mind, I'm happy to add into that we will, not knowing exactly what data everyone wanted to see and knowing that we could, bring all kinds of data. Please do know if there's a particular data set or problem question that you want us to bring forward. We have the expertise to do so. So I just gave a little example of what was doable. But the thoughts behind this as well, Oni, is how do we identify the problem, frame it appropriately, right? So to be honest, I mean, the team is doing this really fantastic work, sort of pulling together, understanding baselines, understanding trends, and then so framing that problem appropriately. And then, as Victor said, sort of identifying what the next steps are. I mean, many of you may not want to hear this in the room, but Delaware County is very resource rich. I think I've been hearing some of the, like, how do we coordinate that? How do we leverage it? How do we identify the gaps and then help the subject matter experts or the agencies that are really tasked with addressing certain health issues? How do we help them do their work better? We've known over a very long period of time that, public health really doesn't get done in the walls of public health, but it actually gets done in the coordinating of others. And so it's the exciting work we'll be embarking on. And this is really demonstration of point, the first step of that. But it's the unknown of where we go next.
I would just say, Melissa, but you guys are doing it through the lens of health equity and ensuring
Absolutely.
that we're looking at, all the different, as we were looking at the differences for heart disease, that the Black population is an increasing trend. So that's like a warning sign, for example, that, and then we would be working on education and other materials to get out to folks.
Yeah. And it is digging down. Is it an access issue? Is it an insurance issue? Is it providers not accepting insurance? Is it not sure how to navigate the health system? Is it trust in the health system? Is it trust in providers? There's all these layers. This is the one indicator, but now how do we dig down into the details and then begin to problem solve?
Is there a plan to kind of go, and it sounds like it is, to go to a more refined layer than the county, right? In terms of geographically and see kind of where the hotspots are?
We have access to data at the census block level, actually street address. However, this is very, very a huge responsibility because when you look at these data sets, the first thing that comes to my mind, we need to find the best way to protect the privacy of everyone. So some of these data sets I do not download. I just see these in the health department because if there is no need to use the data, why download it? So if I do, I remove identifiers just to be sure that it will not end up, because things happen with the internet, So that's what we are going to do, but it requires a responsible way, ethical way to produce results and information from data. Also thinking that the way to present this to the population is to, rather than pointing the finger, this is wrong here, this is wrong there, we want to solicit their help to address the issue by working what would they know and leveraging their resources. So that is the goal. It's a holistic type of approach that we want to go through to do something about, because we look at the data, and we have these results. What are we going to do next? We have to find the best responsible way to address the problem involving the population at large.
And thank you, Victor. I think you've done a really nice job explaining that. And an example could be doing heat maps, because we wouldn't be able to be, this address, but if we have heat blocks or heat maps, we'll be able to say, okay, this is 0 to 1, or 0 to 5 particular cases, and then maybe the next round is 10, 5, so I said 1 to 5, 5 to 10, however we do that grid, then that really begins to concentrate, okay, this is where an issue may be lying. Then typically after that, then you overlay, depending on what the problem is. Let's stick with our topic du jour of STDs and STIs or chlamydia and gonorrhea. We may then overlay on that, okay, who do we think our community partners are in the same area, you know, and then do we do outreach to them? Do you want to partner on us on a particular program? You know, recently was learning about at-home testing for gonorrhea and chlamydia, which is a really exciting thing that might be able to happen here in Delaware County. So would we have partners, whether they're, you know, barber shops or faith-based organizations, community centers, municipalities, and really then start to build that framework on how you're addressing it in the community itself. But it was a little bit of a longer answer than you may have anticipated, but I anticipate seeing more heat map type of things around, especially around those like more acute things that we know are problematic. Those chronics maybe we'll just display that differently, but the disparities are clearly the direction we're going. And in fact, I did share some visuals that I'd like to start to be able to sort of begin to produce. It's really easy to visualize, where you have, I think, is it education, is it income level, or is it census block type of stuff, and you get to really get to see the visualization of it. But we're still just building the framework.
Great, thank you.
And so are you going to sort of address a range of chronic and infectious disease, or are you going to focus on a specific area, try to address that first, or do?
It will be driven by that, really, the health assessment that's underway. And don't forget, that's going to drive sort of the state of the health in Delaware County, with using all the different data sets that Victor explained, primary, secondary, metadata, community input. Then we'll be doing the idea of prioritizing the areas we want to focus on, because if everything's important, then nothing's important, right? So, and the Board of Health will absolutely have an opportunity to weigh in on what those priorities are, as well as the community. And that can be designed on certain things like you sort of say, is the problem urgent, and do we have resources to address it, and therefore it makes sense to do that? Is the problem urgent? We don't have resources to address it, but we want to move in the direction of that. So you may still end up seeing something that's prioritized that's may be very difficult to solve. And then beginning to lay out, you know, the time frame that would happen, the activities that would be required, a bit of a strategic plan for the community, which I really want to stress that the health department helps build this, but we all collectively agree what our priorities are, because again, if it's all important, then none of it's important. So I hope that's helpful.
Yeah.
I'm sure you're probably feeling like we needed a health department a long time ago.
You have to prioritize, because you cannot do everything. If you want to do it well, then you,
And one way to prioritize is to consider the severity of the disease, how many are being impacted and how, disabilities, death, cost to healthcare cost, loss of work and school days. So there is a process, a priority matrix that individuals like yourself, we have the opportunity to select priorities for interventions.
thank you.
Anybody else?
Thank you very much.
Thank you, Victor. Okay, at this time, we have distributed to all of the board members, and it will be public as well, the division reports for the health department for this meeting. And at this time, I want to offer if there's any questions about the division reports. Nope. Nobody? Okay. And I just have one minor thing to change on page 5 under TB. It just said in January 2022, but it was in January 2023.
Okay, good catch. Page 5. The
Under-
Board of Health Divisional Report.
Under
Change
personal.
2022 to 2023.
Yeah, it's where it was specifically talking about the TB
Yep.
outbreak.
Thank you. Good catch, Rose.
All right. And also at this time, I'm very happy to announce or protect the meeting logistics in the future. I don't know if you want to explain that. Melissa?
I mean, sure.
Or- Well, the idea behind this is that the Board of Health would be kind of going on the road to all of the Delaware County Health Department sites, which right now there's 3. So it's Baldwin, the city of Chester, and Yeadon would be the locations. And we are going to try to have our Board of Health meetings at the rotating through those locations. One, to give the Board of Health an opportunity to really see the facilities, and also to allow the public to come in if they wish to see them, and also be in different parts of the county. So we can have the opportunity for people to see what's going on.
Yeah.
Good idea.
I visited your site yesterday in Yeadon. It was beautiful. Nice job.
Good. I think it will also, because Board of Health meetings are open to the public, it almost is, it's an invitation to come, and it sort of takes away maybe the intimidation of going to the health department. They'll be able to come and see and hopefully begin to really interact with us on any type of level that they feel comfortable with. And in Yeadon in particular, we, the third phase of this should have some nice facilities that I'll call them community spaces that they'll be able to request to use really for any type of activity that we can accommodate, obviously. But it doesn't have to be health focused per se. It can be, if they need space. I'm really looking forward to be able to launching that.
That's good.
So our first one will be at Baldwin Tower.
Okay.
I think that's what's on
Yep.
here. Yep. And so we'll have that will have to be sent publicly. And so, we were just talking,
June 1st.
Yep. And I think we had just, John, you said we had to make a public.
Yeah, it's up to you if you just want to do an ad just for that one, or if you know the locations for the
I
rest
think
of
we
it.
can probably do the locations for the rest of them too.
Okay, so if you and Susan can just send those to me once they're set,
Okay.
we can go ahead and put an ad in the paper.
Great.
Great. That was it. And at this time, I'm going to offer any public comment. Okay, seeing none. I'm also going to ask one more time if anybody else from the Board of Health has any other comments for tonight.
No comments.
No? PJ, you good? I think so.
Thumbs up. I see
A
a thumbs
thumbs
up.
up. There you go.
I can't get off mute. I'm good.
Okay, thank you, PJ. I did want to note that PJ was on doing virtual today, and I want to thank also the Department of Health. I see a lot of them were on as well, so thank you all for joining. And at this time, we can adjourn. And then the motion to adjourn.
Motion to adjourn.
Second.
Okay, we're adjourned. Thank you.